Hello students, welcome back. And in this video, we will be talking about the obsessive and compulsive disorder. According to DSM-5, obsessive compulsive disorder here consists of these several disorders, including the OCD itself, the BDD or body dysmorphic disorder, hoarding disorder, trichotillomania, and excoriation. And let's review them one by one. We begin with the most prominent disorder in this group, the obsessive and compulsive disorder. So OCD is the devastating culmination of the anxiety disorders, okay? And it's very common for someone with OCD. It's also experience severe generalized anxiety or experience panic attack or avoidance or major depression. All of this could occurring simultaneously with the symptoms of obsessive and compulsive. All right, so based on the diagnosis criteria by DSM-5, to be diagnosed with OCD, someone has to possess obsession, compulsion, or both. Okay, so even only obsession, someone might diagnose with OCD without compulsion. Okay, so obsession here are intrusive and mostly nonsensical thoughts, images, or urges that the individuals try to resist or to eliminate. While compulsion here are the thoughts or action that they use to suppress the obsession and could provide relief. And according to the diagnostic manual, the obsession or compulsion or both should be time consuming for the clients. Yeah, it should be like more than 1 hour per day. Like let's say you're washing your hands more than 1 hour per day, that you do it again and again. And it can cause serious distress and impairment for someone's life. And here are some types of obsession and compulsion, including the types of symmetry or exactness, and the types of forbidden thoughts or action that include aggressive, sexual, or religious thought or action. It could be also cleaning or contamination, and the last one is hoarding or collecting or saving objects. The prevalence of OCD is more likely found in women, and based on gender-related diagnostic issues, so actually males have an earlier age onset for OCD. And for females, it found that more likely they develop the cleaning OCD dimension, while men or males more likely to have the forbidden thoughts or symmetry dimension. All right. We should then carefully differentiate OCD with this disorder. Yeah. However, it is also common for tic disorder. You know, tic disorder is characterized by involuntary movement. For example, sudden jerking of limbs. Yeah. It is common that someone with tic disorders also having OCD. Yeah, particularly in children. All right, so what are the causes of OCD actually? So many of us sometimes have intrusive, even horrific thoughts, right? Uh, sometimes we also engage in ritualistic behavior, especially when we are under stress. But few of us develop OCD, right? And what causing that? All right, so this could be explained by the hypothetical brain circuit. So one hypothesis is that early experiences taught that um, um, some thoughts are dangerous and unacceptable because the terrible things that they are thinking might happen and they would be responsible for that. So these early experiences would result in a specific psychological vulnerability to develop OCD. Yeah, so there are genetic as well as the psychological vulnerability as well. So when clients with OCD equate thoughts with the specific action or activity represented by the thoughts, that is called thought-action fusion. Again, this generalized biological and psychological vulnerability must be present for this disorder to develop, right? And believing some thoughts are unacceptable and therefore must be suppressed is a specific psychological vulnerability may put people at greater risk of OCD. Okay, so actually the model of the etiology of OCD that is somewhat similar to other models of anxiety disorder. And the treatment for OCD, the most effective treatment seems to be those that specifically inhibited the reuptake of serotonin. Yeah, the drugs here in such as the SSRI or the selective serotonin reuptake inhibitors, yeah, which is benefit up to 60% of the patient with OCD. Sometimes relapse occurs when the drug is discontinued. However, highly structured psychological treatment works somewhat better than the drugs, yeah, but they're not readily available like drugs. Unfortunately. So the most effective approach is called exposure and ritual prevention, or the ERP. It's a process whereby the rituals are actively prevented and the patient is systematically and gradually exposed to the fears, thoughts, or situation. And there's also psychosurgery as one of the more radical treatment for OCD. It refers to neurosurgery for a psychological disorder. So studies suggest that after a specific surgical procedure to lesion the cingulate bundle or cingulotomy, it approximately benefited 30% of the OCD patient, as well as the deep brain stimulation in which electrodes are placed through the small holes drilled in the skulls and are connected to a pacemaker-like device in the brain, yeah. So the advantage of deep brain stimulation over more traditionally surgery is that is reversible. All right, the next the next OCD is the BDD, or the body dysmorphic disorder. So I believe that each of us ever wish that we could change part of our experience, right? Maybe the size of our nose, yeah. And most people fantasize about improving something, but BDD is something different than that. Yeah, it's the curious affliction, and it's the center of the BDD is the preoccupation that with some imagined defect that in appearance by someone who actually looks reasonably normal. And people with BDD complain of persistent, intrusive, and horrible thoughts about their appearance, and they engage in such compulsive behavior as for example, repeatedly looking mirrors to check their physical features. All right, and of course, it causes significant distress or impairment in one client. And one of the specifier of BDD is the muscle dysphoria, or the delusional or exaggerated belief that one's own body is too small, too skinny, insufficient muscular, or insufficiently lean. Also, in most cases, the individual's build is normal or even exceptionally large and muscular already. All right, so in mental health clinics, the disorder is also uncommon, yeah, actually, because most people with BDD seek other types of health professionals, such as plastic surgeons, and dermatology, or even orthodontists, yeah. So it's equally seen in men and women. As you can see here, that most people with BDD may go to the dermatologist, undergo cosmetic surgery, orthodontist, and maxillofacial surgery. And the onset range of BDD is from early adolescence through the 20s and peaking at the age of 16 to 17. And here, men tend to focus on body build, genitals, and thinning hair, and to have more severe BDD than women. And a focus on muscle defects and bodybuilding is nearly unique to men with this disorder. Okay, and while women focus more on varied body area and more likely to also have an eating disorder. And the severity of these disorders is also reflected in the high percentage of the past suicide attempts among BDD cases. And then we should rule out of the symptoms of BDD with this differential diagnosis, yeah, such as normal appearance concern or eating disorder, other OCDs, illness, anxieties, disorders, major depressive disorders, and so on. And another interesting lead on BDD is also comes from the cross-cultural exploration of similar disorders. Here, you may remember the Japanese variant of social anxiety disorders called Teijin Kyofuso. yeah, in which individuals may believe they have hundreds bad breath or body odor and thus avoid social interaction. Yeah, but people with Tajin, Kyo, Fuso here also have all the other characteristic of social anxiety disorder. And the next OCD is the hoarding disorder. So these individuals experience strong anxiety and distress about throwing anything away because everything has either some potential use or sentimental values in their mind, right? Or simply because an extension of their own identity. So the three major characteristics of this problem are excessively acquisition of things, difficulties discarding anything, and living with excessive clutter under a condition, and it's best characterized as gross disorganization. The prevalence of hoarding greater among males, yeah, but clinical samples is predominantly female, and of course it's more prevalent in older adults. And the developmental and course of this problem, they start in adolescence and start interfering with the individual's everyday functioning by the mid-20s and cause clinically significant impairment in the mid-30s. And we should differentiate hoarding from these kind of disorders, including neurodevelopmental disorders, because elderly might develop many of these disorders and showing similar symptoms with hoarding. And the comorbidity of hoarding disorders, they often come together with or comorbid with mood and anxiety disorder, as well as major depressive disorder and another anxiety disorders. All right, so the treatment again, CBT is more likely to be a promising treatment for hoarding disorders, with teaching people to assign different values of object and to reduce the anxiety about throwing away the items. Yeah. And the next OCD here is the trichotillomania, or the urge to pull out someone's hair from anywhere on the body, including the scalp, the eyebrow, the arms, and etc. And this behavior results in noticeable hair loss, distress, and significant social impairment, right? And this disorder can often have severe social consequences. And as a result, those affected can go to great length to conceal their behavior. And the diagnosis criteria here is, of course, recurring pulling hair, resulting in hair loss, and there's repeated attempts actually to decrease or to stop, but then failed. Those why causing distress and impairment in a person. And the prevalence, the compulsive hair pulling is more common than one believes, and it is observed in between 1 until 5% in college students. And females are reporting the problem more than males. And the onset of this disorder is usually in puberty and worsen for female with hormonal changes. And it's the last OCD is the excoriation or skin picking disorder. I'm sorry. Is characterized as the label implies by repetitive and compulsive picking of the skin, leading to tissue damage. So the skin picking resulting in skin lesion, yeah, of course, our tissue damage. And again, there are repeating attempts to stop, but failed, and then cause distress and impairment. And the prevalence is, again, is more likely found in female. And also onset is in puberty, begin with dermatological condition, for example, acne, and continue to develop as excoriation. And this disorder also may come and go. Okay. And that's all about OCD, and thank you for your attention. I'll see you again in the next module. Take care.